I'm Rachel Miller, the Agency Chief Contracting Officer. My office will oversee the logistics of the RFP.
Thank you, Rachel. And now my colleague, Andrew White.
Good afternoon, everyone. I'm Andrew White. I'm Deputy Commissioner in the Division of Policy Planning and Measurement at ACS.
Okay, and finally, my colleague, Michael Moiseyev.
And good afternoon, everyone. I'm Michael Moiseyev. I'm Deputy Commissioner for the Division of Financial Services and the CFO for ACS.
Thank you, Michael. Okay, so now our Chief Contracting Officer, Rachel Miller, will cover some housekeeping and some other key information. Rachel?
Hi, can I give the next slide, please? This is not your typical WebEx meeting. This is called a WebEx event, which explains why you're only seeing panelists, although I can tell you there are literally hundreds, almost 300 of you who are participating right now. You are all muted, and I believe you are unable to unmute yourself. If you have a question, we encourage you to type it into the Q&A box, which appears on the right-hand side of your screen. When we get to the portion of today's agenda for questions and answers, I will read your questions aloud and we'll respond to them. If we're unable to understand what you've written, we may unmute you to ask you to clarify, but I encourage you to write as clearly as you can. Thank you. Next slide. So Julie mentioned a little bit about the purpose of today's session. We want to give you some basic information about the timing of the upcoming RFP, and we want to remind you about the process that informed the RFP. And we want to solicit information from you about the very thing that has changed so dramatically since we released the concept paper in 2019, which is the pandemic. What this is not is a sort of open session on the concept paper, but you'll hear a lot about information that was presented in the concept paper. There are some restrictions imposed by the city's procurement rules on what we can and cannot say today. But today's session will be recorded. It is being recorded, and we will post the recording as well as this slide deck on our website. Okay, so just before we move there, I just want to remind you that we did release a concept paper in 2019. It was on our website for more than 6 weeks, and we invited your comments. We got lots of comments from you, and we thank you for those. You'll see and you'll hear more today about the way that we incorporated some of your comments into the RFP. And as I say, the one thing that the concept paper did not address was how to maintain operations and innovate even in the face of a global pandemic. So that will be a significant focus of today. In addition to posing your questions in the Q&A box today and getting our responses, we invite you to pose questions to us through email, and you can do that through March 9th. I believe the email address was in the invitation to today's session, but just to repeat it, it's fostercare-cp@acs.nyc.gov. fostercare-cp@acs.nyc.gov, and we'll repeat it again later. Okay, so toward the end of the session today, we'll look at your questions and respond to them. I'm going to turn things back over to Julie.
Okay, thank you, Rachel. Okay, so in this section, we're going to take you through a brief overview of ACS and of the foster care system. and share a little bit of data and other context. ACS is responsible for the safety and well-being of New York City's children and families by providing child welfare, juvenile justice, primary prevention, and child care services. We have 5 primary areas of services. Child and family well-being is primary prevention support, where we deliver child care vouchers. We have family enrichment centers, we have community partnerships, and that is all in the zone of providing primary prevention to children and families in New York City. Then we also have prevention services. We have a network of providers, nonprofit organizations that we are working with to support families in need with an extensive prevention continuum. Our child protection function responds to reports that are made to the statewide hotline of suspected abuse and neglect. And in this function, ACS assesses child safety, investigates allegations, offers support to families, makes referrals, and so forth. In family permanency, which is the division that I oversee, ACS contracts with nonprofit organizations that deliver foster care services, the goals of which are to achieve safety, permanency, and well-being for children and families in the foster care system. And then finally, we have the juvenile justice component within ACS. It's called our Division of Youth and Family Justice, where we are delivering detention, placement, and intensive community-based prevention and diversion programs for young people that are in contact with the juvenile justice system. You can go to the next slide. So New York City has experienced an absolutely dramatic reduction in the numbers of children in foster care, from 42,000 children in care 25 years ago, about 16,000 in 2010, and fewer than 8,000 today. And during this time, as you can see in the chart, you see foster care going down. There has been a 200% increase in terms of the numbers of children in families receiving prevention services. So this is obviously an extremely important context, and one that we are committed to, continuing to build upon. And we've accomplished this, the reduction in foster care, by expanding prevention services, reducing the numbers of children that enter foster care, and then for those that do enter care, reducing the length of stay. So we'll go to the next slide. So ACS has a very substantial prevention services continuum, and that continuum of services is highly effective. We have about 20,000 families with about 41,000 children that are served annually in our prevention programs, focused on supporting and strengthening families to keep children at home and keep children safely out of foster care. And in fact, those programs are highly successful at doing exactly that. More than 70% of families successfully complete prevention services, and those families that complete services are 5 times less likely to have another substantiated investigation of child abuse and neglect within 6 months. We've done an extensive survey of families receiving prevention services, and 94% of the parents surveyed reported that they were happy with the service. 86% said that the service was helping them to meet their goals. 71% said that they would recommend the services to a friend or family member. So these and other findings indicate the high level of success of our prevention programs. So in 2019, ACS issued an RFP that further expanded and strengthened our prevention continuum, and those contracts began in July 2020. And similar to foster care, This was the first complete restructuring of that system in more than a decade. And it is extremely exciting that the new prevention system expands evidence-based models and provides citywide access to every single model that's being offered across the city to all families in need. We can go to the next slide. So in the area of foster care, we touched on this a bit, but ACS contracts currently with nonprofit agency partners to provide safe and nurturing environments for children who cannot safely remain at home and to work with their families. And when children enter foster care, ACS and our partners, we work to achieve three primary goals: safety, that children are protected from abuse and neglect; permanency. When children are placed in out-of-home care, the primary goal in the vast majority of cases is to work with families to achieve safe reunification. And when reunification is not possible, then to achieve permanency through adoption or kinship guardianship. And then the third area is well-being, that when children are in foster care, we are working to ensure that they are receiving appropriate services to meet their health, mental health, educational, social, and other needs. You can go to the next slide. So over the last 5 years, we have been aggressively implementing a foster care strategic blueprint that outlines our key priorities and strategies for improving safety, permanency, and well-being outcomes for children and families involved in the foster care system. Each year, we issue an annual progress report that documents our work against this blueprint, and all of this is available on our website. And so we have seen over the last 5 years very significant progress, including, as I mentioned, fewer than 8,000 children in foster care, coming down from those very large numbers. Just a few years ago, let alone a decade ago or 25 years ago. We have also reduced length of stay in care. The number of children who are in care 2 years or more has been drastically reduced by 25%. Kinship placement, we know that kinship care is good for kids. We know that from research and from practice experience. And over the last 3.5 years or so, we have been very successful in increasing the proportion of children placed in kinship care, increasing that from 31% a couple of years ago to now 42%. We've also significantly increased the number of new foster homes from FY17 to FY19. We increased the number of new homes recruited by 50%. And that turned around a previous 6-year decline where the numbers of new foster homes had been coming down. At the same time, we have significantly expanded a range of education and employment programs for children and youth in foster care. Significantly, we've launched Fair Futures, which is the first of its kind program to provide dedicated coaching and tutoring, education, employment, housing specialists, other resources for young people in foster care age 11 to 21. We've increased a range of other initiatives in partnership with New York City Department of Youth and Community Development, with the DOE, with CUNY, with Columbia University, with an organization called First Star, working with multiple foundations and other partners on a range of education and employment initiatives to improve education and employment outcomes for young people in foster care, while at the same time still working to achieve permanency for those young people. We've also increased opportunities with mentored internships, summer youth employment, career clubs, college readiness, college success programs, and more. And so This work from the Foster Care Strategic Blueprint provides an important platform as we move to the next generation of foster care contracts and continue to accelerate the goals that we have of improving outcomes for kids and families. So I think we'll go to the next slide here. And so now I would like to turn things over to Lauren Gannot, who is Chief Operating Officer and Chief of Staff in the ACS Family Permanency Services Division. And Lauren will take us through an overview of the RFP timeline and planning, as well as the discussion piece about lessons learned during the pandemic. Lauren?
Thanks, Julie. Can you hear me okay?
Yes.
Okay, great. Thank you. Okay, so the RFP will be released in spring of 2021. And the contracts resulting from the RFP will begin on July 1, 2022. So as we've mentioned, the RFP was originally planned for release in the spring of 2020. However, it was delayed by 1 year due to the COVID-19 public health crisis. So through the RFP, we're seeking to use this transformational opportunity to scale best practices and proven strategies to achieve the best possible outcomes for New York City children and families. We're seeking to align the New York City foster care services with the implementation of the new federal Family First legislation. And we're looking to implement a shared framework across prevention and foster care services that aims to shorten stays in foster care and to provide greater support and stability to families during reunification following foster care. So in anticipation of these procurements, we undertook an intensive research and planning process. We reviewed and analyzed existing service models and outcomes in New York City. We reviewed evidence-based and best practice models and research in the field. We conducted extensive consultation with stakeholders throughout the child welfare continuum through interviews, focus groups that included youth, parents, advocates, parent advocates, foster parents, legal advocates, child welfare experts, and foster care agency staff at all levels. And I just also want to note that we co-designed the stakeholder engagement process with the Division of Prevention Services, as they were also planning for their procurement. However, the outreach that we conducted was foster care specific. So in November 2019, we issued a concept paper. There was a 6-week public comment period for the concept paper. We received extensive and detailed comments from a wide range of stakeholders, and this feedback that we received is informing the development of the RFP now. So this slide provides a high-level summary of our findings from our review of the current New York City practices and the best practices research, as well as from our stakeholder engagement process. The purple boxes in the top row both relate to the fact that as the foster care population has shrunk, we've seen more acute needs among the children that do enter foster care. As such, and so our research and the stakeholder feedback that we received reflected this as well. As such, the key findings from our review indicate that increased therapeutic and trauma-informed services are needed to meet the needs of children and families. In both family foster care and residential foster care, we need to respond to the more acute needs of children, of youth, and care. Relatedly, our review also found that the current structure of having separate contracted family foster care and therapeutic foster care contracts has its challenges, and because we know that children and families' needs change over time. The green boxes speak to our findings about permanency. While we've made a lot of progress, there's more work to be done to improve permanence outcomes for children and families. As discussed earlier, when children are placed in foster care, our primary goal in the vast majority of cases is to work with families to achieve safe reunification, and most children in foster care are reunified. However, when reunification is not possible, our goal is to achieve permanency through adoption, kinship, guardianship, and adoption. The first green box covers a key finding pertaining to the reunification work which is that investments in parent advocates with lived experience and in family time supports will help increase and sustain family reunification. Growing evidence demonstrates that parent advocates are uniquely capable of engaging families and reducing families' involvement in foster care, and that parents themselves identify advocates as a critical investment that helps support successful reunification. And we know from research that frequent high-quality family time, also known as visiting, is one of the most important predictors of successful reunification and achievement of permanency. The second green box speaks to the need to continue, support, and fully scale a range of existing investments and initiatives to further improve permanency, including low caseworker caseloads, targeted initiatives for older youth to achieve permanency, kinship guardianship, and other strategies. This is an opportunity to more effectively address the foster care system's most pressing needs and challenges, including long lengths of stay in care that we are working actively to reduce. The dark blue boxes relate to the children's placements in foster care, ensuring that they are nurturing and trauma sensitive and that they support permanency through reunification, adoption, kinship guardianship. The first blue box speaks to the finding that children in foster care fare best with kin. While ACS has been extremely successful the past few years in increasing the proportion of children placed with kin, there continues to be opportunity to increase this further with additional resources. Research shows that the behavior, mental health, and well-being of children placed in kinship care is better than that of children placed in traditional non-relative foster care, and that children placed with relatives are least likely to experience placement instability. The second blue box speaks to the finding pertaining to foster home recruitment and support. As mentioned earlier, ACS's Home Away from Home initiative has been successful at increasing foster home recruitment and support over the last several years. This work can be further accelerated and scaled with additional dedicated resources. The orange box relates to child well-being in terms of our opportunities to build on current education and employment initiatives for children in foster care. Dedicated staff, including tutors and coaches, who are specially trained, and programming that is specifically designed for children and youth in foster care can help improve education and employment outcomes for young people, while we continue to work aggressively to achieve permanency and to reduce the numbers of youth, while we continue to reduce the number of youth aging out of foster care. The pink box in the middle of the bottom row speaks to the finding that additional targeted strategies are needed to address racial disproportionality and to promote equitable outcomes. The families we serve are impacted by social systems, structural racism, and other forms of discrimination. Targeted strategies are needed to address disparities related to race and ethnicity, income, gender, sexual orientation, gender identity, and expression. And finally, the light blue box at the bottom of the right, on the bottom right-hand side, speaks to the findings around the provider organizational health that's needed in order to ensure high-quality services. To support strong performance on safety, permanency, and child well-being, providers need adequate and predictable funding structures. Moving to the next slide. So in the next few slides, I'm going to summarize as a reminder for everyone the key elements that were included in the ACS concept paper. In the concept paper, we stated our intention to continue to advance the goals outlined in the ACS foster care blueprint. And just for everyone's reference, we have some links and resources at the end of the presentation, including a link to our blueprint page. But we wanted to review this here now as well. So the goals that we outlined in the concept paper include improving safety and permanency outcomes. So we are looking to contract with providers to implement a range of targeted strategies to improve safety and permanency outcomes for children and youth in foster care, including strategies to improve placement stability, reduce children's length of stay in care, and to improve safe and lasting reunification, and to expedite coordination of adoption and kinship guardianship for children who cannot safely reunify. Improving foster care placements to enhance safety and well-being. So we are hoping to contract with providers who will share ACS's commitment to increase placement with kinship caregivers, Furthermore, ACS seeks providers who will implement best practices and innovative approaches to recruiting, training, and supporting foster parents. Improving health, mental health, and education services for children in foster care. To improve the well-being of children in foster care, we're seeking providers who will connect with children and youth in care with services that promote healthy development, health and mental health, and educational outcomes. Improving outcomes for older youth. We're seeking providers who are committed to improving safety, permanency, and well-being outcomes, and reducing the number of youth aging out of foster care without a permanent connection. Nationally, we know that youth aging out of foster care have poorer educational outcomes in college enrollment and attendance, persistence and graduation rates than their peers, and face high rates of unemployment and homelessness as adults. ACS expects its providers to leverage the significant education, internship, college, career, and vocational initiatives that ACS and other service delivery systems offer, and to deliver supportive services that improve outcomes for older youth in foster care. And finally, we are seeking to build system capacity. To support a well-prepared and stable workforce, ACS provides core and specialized trainings for case planners and supervisors, technical assistance, and case consultation to providers. Providers will maintain low caseloads, recruit and retain an adequate supply of foster homes, implement effective business processes, and implement trauma-informed and evidence-based promising and best practices. Providers will receive the resources they need to deliver high-quality services in a socially just manner to meet children, youth, and families' needs. So next, I'd like to cover the initiatives and investments that we talk about in the concept paper. So we described in the concept paper several critical new initiatives and investments, and these include, first, enhanced family foster care. When we talk about enhanced family foster care, what we're referring to is a new approach that combines regular family foster care and therapeutic family foster care, and integrating into one model called enhanced family foster care. EFFC will include access to a wide range of therapeutic services and supports to allow for greater flexibility to meet the range of complex needs of children, youth, and families as they change over time. A continuum approach will enable resources to follow the children rather than children having to move to different programs, for example, from regular to therapeutic when their needs change. Providers will utilize a universal assessment tool to be chosen by ACS that will be administered upon entry and then at regular intervals to identify strengths, challenges, and the levels of need to support service planning. Providers will provide therapeutic training to all foster parents. Next, residential program enhancements and Family First implementation. So through the RFP, we're seeking to support residential care programs that will integrate evidence-based models and staff supports that will promote transitions to family care, so that for most children, residential care is a short-term experience for treatment and stabilization rather than long-term care. And so this describes both sort of the programmatic goals that we hope to achieve through residential care, as well as the requirements of the Family First legislation. Next, Strong Families New York NYC investments. ACS will build on the investments made through Strong Families NYC with average caseloads of 10 for case planners, for case planning staff, and supervisory ratios of 1 supervisor per 4 case planners to support ongoing weekly supervision and case oversight. So next, we're looking to make targeted investments to improve outcomes. Through the new contracts resulting from the RFP, ACS will make targeted investments in research-driven best practices to improve safety, permanency, and well-being outcomes. These investments will focus on the following areas: parent advocates and family time, foster parent recruitment and support, kinship placement, and education and employment. And finally, performance-based contracting, shared risk, and cost-based reimbursement. ACS recognizes that providers have fixed costs and exploring different payment structures, and we are exploring different payment structures to factor in such costs. ACS is also assessing the feasibility of implementing an approach to performance-based contracting that is data-driven and designed to reward strong provider performance. ACS is also exploring the implementation of shared risk measures related to certain activities that impact federal reimbursement, such as foster home certification and the timely submission of care days. Combined, performance-based contracting, shared risk, and cost-based reimbursement are intended to reward providers for achieving outcomes while maintaining their fiscal and organizational health. Okay. So now I want to turn to our discussion about lessons learned during COVID-19. As Rachel Miller noted, because of the COVID-19 pandemic, because it occurred after the concept paper was completed, we wanted to provide this opportunity for feedback specifically around lessons learned during COVID. This slide highlights the opportunities that we've identified through ACS's work and through discussions with key stakeholders. As we all know, the COVID pandemic forced us to use technology in different ways than before. And we realize that in doing this, that many of these strategies are extremely useful to continue even after the pandemic is over. Of course, this is not to say that virtual approaches should completely take the place of in-person work, but that there's an opportunity to enhance our work using virtual technology. So the items that we've identified include virtual parent, child, and sibling visits to supplement in-person visits, virtual foster care agency staff contacts with children, parents, and foster parents to supplement in-person contacts, virtual foster parent recruitment, support, and training, virtual staff development and training, virtual case conferences, virtual ACS provider meetings and other meetings, and finally, telehealth or mental health services provided virtually. So these are the items that we've identified. As Rachel mentioned, we invite you to submit comments on COVID lessons in the QA box today. And ACS will also be accepting comments about COVID lessons learned until March 9th. And those comments can be submitted to the mailbox Rachel mentioned earlier, and we also have that listed on the resource slide. So now I'm going to turn things over to Rachel to review the Q&A that has been submitted during the session. Rachel?
Good afternoon. So we have only one question in the Q&A box, so I encourage you to add yours. We did receive a couple of questions in advance. One I feel confident we've answered, which was to what extent we have incorporated or reflected comments from the concept paper in the development of the RFP, and the answer was substantial. The other questions were specific questions about the concept paper. I think we've answered them, but as I mentioned, that's sort of not the purpose of today's session. So we are looking for questions and feedback about the pandemic. Nevertheless, I will read the one question that we've received so far in the Q&A box. The question is, being that poverty is not neglect, is ACS open to a discussion with advocates regarding ideas to provide direct assistance to families without the need for surveillance? And I'm going to look to my colleague, Andrew White, for a response.
Happy to take that. So we strongly agree that poverty is not neglect. We also know that involvement with ACS correlates with poverty, and that families with few resources are far more likely to experience the kind of severe crisis that leads a child to be placed in foster care, which is the subject of this discussion today. And that's whether that's a challenge related to mental health or substance use or something else. So we're implementing quite a few strategies across ACS that are geared directly to reducing families' involvement in foster care and trying to reduce families' involvement in the child protection system in the first place. A lot of that has to do with trying to reach families with resources before they come to the attention of somebody who calls the hotline. So we've been engaging parent advocates and parents' attorneys and community-based providers and community partners in the development of these strategies, and we certainly intend to continue to do so. Rachel?
Thank you. The next question, I'm not sure it actually is a question, there's a comment. housing is what's going to change how families get housing, I think is the question. I'm not sure if that's related to the pandemic or a general comment about or a question about how ACS is going to facilitate how families get access to housing. Any of my colleagues want to respond?
Yeah, this is Julie Farber. I can take a shot if I think I know what the question is. Housing can never be the barrier to reunification. If parents and children are ready to be safely reunified, we work to make that happen, regardless of whether a parent, is in a shelter or so forth. And so ACS is committed to continuing to work to ensure that families that are reunifying from foster care have access to all of the various resources that may exist, whether that's NYCHA or supportive housing or other housing settings. And we have dedicated offices within ACS to assist those families.
Thanks, Julie. Next question. It sounds like virtual visits will now be included in the concept paper, by which I think question means RFP. If yes, excellent.
We appreciate that comment. And as Lauren noted on the slide, we've definitely learned a lot, I think, in COVID, where there is opportunity for technology to enhance in-person. Obviously, there's a lot of importance for in-person contacts and visits and so forth to still continue, but the use of video technology presents an excellent opportunity to enhance our practice.
Another question about the pandemic. What does ACS's data show with regards to foster parent recruitment and retention during COVID-19?
Yeah, so thank you for that question. So there was definitely some impact from COVID in that the pipeline of prospective foster parents did shrink a little bit. But foster care providers have been working very hard to, number one, make some adjustments in the context of COVID, which we've been able to do. ACS in collaboration with OCFS, we're able to figure out, where there could be some flexibility around foster parent training and certification. We moved all of the training online and so forth. And so I think we're in the process now of building back. But yes, there certainly was some impact during COVID.
Thank you. The next question, how will the pandemic lessons learned be used to inform the RFP? Julie?
So, well, I think, essentially the items that we identified on the slide that we shared, where there's an opportunity to do things a little bit differently, in addition to having, for example, in-person foster parent support groups, using technology and having Zoom foster parent support groups, and sort of applying that across all the different areas of practice. We think we have identified that as an opportunity. And I think what we're asking for today is some of your feedback and thoughts on how you think those pandemic lessons learned could and should be applied in the RFP. And so that's what we're looking for from this group in terms of feedback today. And then, as Rachel and Lauren mentioned, you can continue to submit sort of COVID-related lessons learned and feedback to the email box until next Monday.
I want to remind you that you should submit your questions in the Q&A box. There is a chat box that I thought that you would not be able to see, but someone did submit a question there, which I'm going to read. But I direct your attention to the Q&A box on the lower right-hand corner of your screen. The question is, will families be given iPads or other equipment in order to facilitate teleconferences and enable children to continue in school during lockdown? Yeah, go ahead.
Yeah, so that has been the case, that we have provided funding and mechanisms for foster care agencies to procure technology for parents, foster parents, and children and youth for exact purpose described in the question.
That said, I just want to remind you that the contracts resulting from this RFP are not expected to begin until July 1st, 2022, and we certainly hope the children will be in school then.
Yes, we do hope that.
Next question. Will agencies applying to the RFP be required to identify an evidence-based or informed model they will use? And if so, will there be a list of models to choose from? I'm going to take that question. This is a level of detail that we're not going to get into today, but I want to remind you that once we issue the RFP, and the spring is not far away, I'm determined, we will have a public pre-proposal conference during which you will be able to ask any questions you have about the RFP. Next question. Is ACS, I'm sorry, I lost it there. Is ACS going to set a minimum number of families or foster children that an agency will be responsible to work with? Again, that's guidance that will be made clear in the RFP, which will come out shortly. Similarly, are only licensed foster care agencies allowed to apply for the RFP, or are other entities allowed to apply for an RFP if they have specific skills in their ability to recruit foster homes or supporting and networking foster families? There was a little bit of guidance about that in the concept paper. There will be a lot more in the RFP. Question, I understand that the RFP will be issued this spring, but would like more clarity on the timeline for planning purposes. On what date will the RFP be issued, and what is the submission deadline? Oh, I wish we could give you that. We don't know exactly. Many of you know that the city is now using a new procurement system for RFPs, a new version of Passport. The RFP will be issued in Passport, and I can't give you a date, but we can say that it will be not the first day of spring, but solidly in the spring. I'm sorry, we can't give you more detail than that. Next question, are the numbers of placements in foster care presented here impacted by COVID-19? And if so, wouldn't a comparison to 2019 be more realistic? I'm going to turn that to my colleagues. And by comparison, I'm not sure exactly what's meant.
Can you read it again, Rachel, please?
Are the numbers of placements in foster care presented here impacted by COVID-19? And if so, wouldn't a comparison to 2019 be more realistic?
So the number of placements in care has come down steadily. There was a uptick in 2017, but otherwise the pace of placements into foster care has been on a steady downward trend every year, except that year, going back a decade. The number of children in care has also come down every year. certainly 2020 was an exceptional year in terms of the data. So you're right on that point. However, 2019 is significantly lower than 2018. So the trend is downwards.
The concept paper seemed to make the continuation of Strong Families NYC features, especially reduced caseloads, on the availability of sufficient funds. Today, you seem to confirm the 10-to-1 caseloads will be intact, also the 4-to-1 supervisor ratio. Is this correct?
I don't think we can say it's confirmed until the RFP comes out.
I mean, I think what Lauren described today was the aspirations described in the concept paper, and we can confirm that that is still what we would like. Question, sorry. How many total contracts are expected to be issued for enhanced foster care, enhanced family foster care? I think that means that's something that will, an anticipated number of contracts will be made obvious, made clear in the RFP. Next question, will the virtual contacts include FTCs?
So we had listed on the slide, you know, the opportunity of using virtual technology for family team conferencing. So that's, you know, that was listed on our lessons learned slide that we presented. And so we'd be open to your feedback on your thoughts about that.
Can you please share more about the size of programs you are expecting to fund and the geographic distribution? That again, you get a hint of that in the concept paper, and particularly, in particular the geographic distribution, but the precise numbers and size of programs will appear in the RFP. Is there any plan to incorporate additional funding? Oh, I'm sorry, I have my mouse runs away from me. Is there any plan to incorporate additional funding that can be offered to families for basic resources? How will transition to EFFC alter rates? In terms of rates, you will see details of that, a primary detail in the RFP. With regard to the question of additional funding that can be offered to families for basic resources, I'm not sure if that question refers to the model that will be presented in the RFP or right now. If it refers to right now, you know, we can answer that. If it's in the RFP, you'll see that shortly. But anyway.
Yeah, I think we can say that, you know, many of our prevention programs, which are often tied to the foster care programs, do provide economic stability, economic initiatives to help families, whether it's accessing public benefits and SNAP, or better yet, helping, you know, really long-term stability. We have models that are it's described in the concept paper in a very short way, how prevention and foster care can collaborate.
The next question is, will the slides be sent out? And to repeat, they will be placed on the ACS website along with the recording of this session. Next question, to confirm, would telehealth exist beyond the current emergency executive order with this RFP? If so, will agencies be required to attain approval from OMH to facilitate these sessions?
So I think there's been universal agreement among folks in the field about the benefit of telehealth and seeing, you know, increases in young people participating in therapy, and so there is advocacy for that to continue. I think that is both a federal and state Medicaid decision in terms of whether they will, continue allowing that. But we certainly hope that to be the case.
Have you explored with other states having continued virtual visits after the pandemic on ICPC cases for children living outside of New York State?
So thank you for that feedback, and certainly something that we can take back and explore as that's relevant. That's a great relevant comment about, pandemic practice. Thank you.
Will consideration be made to conduct virtual home studies for new foster parents?
So again, we, have noted the benefit of sort of having foster parent, orientation and training materials. In terms of whether we would replace a home visit with a virtual visit to certify a foster home, I'm not sure about that. But what I also need to note is that is actually, those requirements are under the purview of OCFS, not ACS.
Something that seems to be a comment, not a question. As far as parenting classes, we need more in terms of multiple classes, not just one size fits all parenting classes. I believe the RFP will present a comprehensive range of services. Next question, has ACS decided whether to include the YRC programs as part of the RFP? If so, what does it mean in the concept paper about exploring the option to convert some or all of the YRC programs to being part of placement programs? Lauren, I think you're going to take that.
Yes, and Rachel, just so I'm clear, can I give the clarification? Yeah.
Yes,
okay.
You can.
Okay. So as we stated in the concept paper, and this is on page 15 of the concept paper, we are still exploring the option to convert some or all of the current youth reception center pre-placement beds to placement programs through the RFP. And so we are still exploring this option, but should we decide to convert some of the pre-placement capacity to placement, this means that the YRCs would have the full responsibility of a residential foster care program and have case planning responsibility, and would no longer be considered a pre-placement program. Should they, should any of the current YRC providers opt to apply for the RFP and be awarded a contract?
Thank you. If you don't hear your question, if I don't read it aloud, it's because it's a duplicate that we've already answered. Next question, how much time from launching the RFP will we have to submit proposals? The answer is adequate time. We expect that you'll have at least as much time as is required by the city, and we will try to give you more in light of the fact that you're using Passport for the first time, many of you. Next question, why only a 6-month follow-up post-completion of preventive services? I think this refers to some data that we provided earlier in the presentation. Andrew, Julie?
Oh, I think the question is referring to the data about how frequently families who participate in prevention services and complete prevention services end up having a new indicated report or a child entering foster care. So we track it, sort of follow these federal standards, and we track it by 6 months and then 12 months. The numbers actually are very strong at the 12-month point as well. It's extremely unlikely for a family that completes prevention services with some or all goals achieved to then have a child end up in foster care within a year. It's something 1 out of every 68, I think, is what we found in a data run we did recently. 1 out of every 68 families that participates and completes prevention services has a child enter foster care within a year after completing services. So it's just one of the ways to report the numbers.
Thank you. Question, even if school is back at the time these contracts begin, the pandemic has shown the digital divide so emphatically that providing children with technology is still very important to keep them able to do homework, research, etc., and for visits and telemental health. Can ACS provide technology, presumably?
Sorry, I'm not seeing that question. I'm looking for that.
Yeah, it's right after the 6-month follow-up. So the question is, even if school is anticipated to be in person and in July 2022 and going forward, the pandemic has shown that the importance of having technology hardware for children is really important to help them with homework and research. Is this something that ACS would consider including or is planning to include in the programs envisioned by the RFP?
I see. It's a really interesting question, and I think probably also a question for our partners at the DOE in terms of all kids in school benefiting from having devices. So thank you for that feedback.
Another pandemic-related question, but I'm not sure we can answer this. The question is, how will the role of the courts shift as we move to leverage technology to support permanency? Any of my colleagues want to take that?
I'm not exactly sure what that question is asking, but we are working very closely with the court to try and move permanency forward, wherever possible, including, as we've reported, ACS has been, conducting proactive reviews of cases to try and identify cases that can move forward, via stipulation and so forth. So I'm not exactly sure what this question is asking.
Okay, we may have time to come back to it. Next question. Has there been an increased number of reports to ACS from New York City schools tied to student absence resulting from remote learning? If so, how is ACS managing those cases? Okay, not precisely a question about the RFP. I mean,
I suppose we could say it's relevant in the sense that, certainly the impact of the COVID experience has adjusted our work with the DOE somewhat. And some of the lessons learned there, I expect will continue into the post-COVID era, including helping educate DOE staff on when it is and is not appropriate to make a call to the SCR, for example, around technology issues exclusively. I think the value would be if you have comments, if any of you have comments about that sort of intersection of ACS and the DOE that you want us to consider that are COVID related, please send them our way.
Yeah.
Thank you. Question, are virtual FTCs working well thus far? Oh, actually, no, that's not a question. That's an exclamation point. It says they are working well thus far. Thank you.
Great. Good to know. Thank you, Carol.
Similar, okay, there's a little typo. Similar to a host home to further support youth who are aging out of foster care system and at risk of homelessness, is ACS seeking to extend support and resources to assist this very vulnerable population of youth and young adults through this RFP?
So all of our work and essentially all of the initiatives in the RFP are designed to increase, accelerate, enhance, improve permanency outcomes so that, the vast majority of children can return home to their families, and those that can't would exit foster care to kinship, guardianship, or adoption. And all of that is towards the goal of reducing the numbers of youth in care who age out. At the same time, we talked in the concept paper about important initiatives like Fair Futures and others that are working to improve education and employment outcomes, while still at the same time we're working towards achieving permanency for young people, so that we have fewer and fewer young people who are aging out.
If virtual home visits are permitted after the pandemic, will the federal government recognize these visits as face-to-face contacts?
So we don't know that answer, what the federal government will count, but obviously we'll look forward to seeing that. But I think most importantly is that we will want to determine when in-person versus virtual is appropriate based on safety circumstances. And so that's obviously, consistent with our approach of keeping children safe.
The next question was, can we estimate when the outcomes of the RFP will be, when providers or proposers will be notified? It's not a redundant question. We anticipate it will be sometime in the late fall. Question, how has foster care Medicaid redesign informed ACS's thought process around foster care procurement?
So thank you for that question, and it's important, and Medicaid is a key part of the system, since children in foster care have Medicaid and can receive a range of health and mental health services through Medicaid. And I think what we discuss in the concept paper is that it is critical for providers to be fully leveraging Medicaid services, including obviously the services through Medicaid managed care, which will be going into place, health homes, and CFTSS services. And so those are all very important for children to get the services that they need.
A related question, also, I think, informed by the concept paper, to the extent that new program types are delineated in the RFP, how will these new program types align with the program types delineated by OCFS for the purposes of the residual Medicaid per diem? This may be a level of detail that will be more obvious in the RFP, if so, but if there's anything you can say that's supported in the concept paper, feel free.
I don't think I have an answer to that question specifically. I don't know if Alex or Andrew do. We certainly could circle back on it.
Yeah, we can't elaborate beyond what's in the concept paper at this point.
Okay.
Medicaid managed care is something we are very focused on, as it says in the concept paper.
That is all the questions that that I see in the Q&A box. We can wait just a couple more minutes if anyone's furiously typing, and if not, we'll remind you how you can submit questions by email.
So I'll cover this last slide, and maybe we'll do one more check of the Q&A before we sign off. So throughout the presentation today, we mentioned a few of these resources, and I just wanted to make sure that everybody was aware that this last slide of the presentation, which will be posted on the ACS website along with this presentation, has these very helpful links. So first of all, we have the email address for the email box that you can submit questions to after today's presentation. And as Rachel mentioned, we'll be accepting comments until March 9th. We've also included the link to the foster care concept paper. We've also included a link to other materials which cover the sort of the work produced from the planning phase of the RFP that we talked about. And finally, we also have the link to our ACS Foster Care Strategic Blueprint page, which not only has our current blueprint, but the original blueprint and all of our status reports and annual reports since FY 2016. So that's all here for you to have. And like I said, we'll send an email out once these links are up on the ACS website, the recording and the PowerPoint. Rachel, has anything else come in?
No, nothing else has.
Okay. So
I'm sorry.
There is one more.
There is one more.
okay.
Okay, we can take this last one.
Okay.
I'm assuming that the shift to enhanced family foster care will come with additional contact requirements and other mandates. To the extent possible, can you talk about the new mandates and supports from ACS? That is a level of detail that we can't unfortunately discuss today. You can reread the concept paper and you may find some more information there. Otherwise, hang tight a few more weeks.
Okay, any other final comments from the panelists? Okay, so thank you all for joining us today for the Foster Care and Residential Services RFP Public Information session. That concludes our presentation. Thank you.
Thank you, everybody.
Thanks, everyone.
Bye-bye.